It's also an advantage when you're looking at occlusal clearance to be able to use tools like the Occlusogram. So once you've prepared the tooth and you think you've taken away adequate amount, being able to use the tools to visualize, oh, I maybe just need to reduce the distal margin a little bit more. You can easily just cut that section out from the scan, re-prep, and just scan that bit and it's added in. So it saves time. You haven't got to go back and do the whole thing again.
So another tool in the Elaine Oral Health suite is the Occlusogram, or as I call it, the occlusal heat map. And that's because a range of rainbow colors showcases to you and the patient in real time where the high spots are in a patient's occlusion. Now, we all know how complex occlusion is, and yet we also know that we have an overly simplistic tool to assess it. Now, a piece of blue paper in a set of tweezers is not good enough for me. Patients can't see it, and it really doesn't highlight the complexity of what we're trying to assess and diagnose. But the occlusal heat map is instant and shows patients where they have a high spot. I've loved little personal stories where patients come in on a new set of restorations and says, this one's clashing. And we scan and it shows them that they weren't making it up. And I now replace the blue piece of paper with the occlusal heat map because it's far more complex and far more visual for everyone concerned.